This morning I'm going to talk about concussion, which is a hot topic nowadays, and there's a lot of misunderstanding, and I hope by the time I'm finished that you all have a good understanding about concussion and can speak relatively intelligently about it. So why is this such a hot topic? Well, there are over 1.7 million sports-related concussions. That's sports-related. That's not all the other concussions of people falling at home and so on. Reported annually in the United States alone, and millions more worldwide. The amount of money that this costs is in the multiple billions of dollars. And concussion is unique in that it appears to be mild. In fact, not very many years ago, 12 to 15 years ago, if we saw a driver maybe a little bit unconscious and wake up by the time we got to the car, we would actually say or think, oh, he's lucky, he just had a concussion. But now we know that concussion is not a minor thing, and that recurrent concussions, too many, too close together, can cause chronic illness and dementia in later life, and I'll talk about that in a little bit. Long-term dysfunction can follow repeated clinical and subclinical concussions, and what these are concussion-like things that really don't involve any significant symptoms. And it's estimated that up to 25% of retired NFL players have early dementia. Over 98% of sports-related head injuries are concussions, and there is still a lot of misunderstanding even within the medical profession. The top three are American football, have by far and away the most concussions. Women's soccer is second, and ice hockey is third. Lacrosse is up there relatively close, and rugby, but American football is still way out there. The incidence overall in motorsports is really unknown. In IndyCar, which is very good with concussions, there were only 5 concussions documented from 2012 through 2014. So that's in a 3-year period. The problem is when you don't have all of the safety features, and in some of lesser series and so on, there's many more, and a lot of them go unreported because there's not somebody really looking for it. And one of the issues they have, especially in Europe, because they have so much club racing, is the teams are befuddled in a way because somebody brings a race car to a racetrack, races over the weekend, has a concussion, isn't really aware that they had a concussion, nobody really paid attention, and then they drive back home and end up having a crash on the highway. And it's all because they had an undetected concussion. We're going to talk about football as a major issue because that's where we learn most about concussion nowadays. It's estimated that 4.5 million kids play football in the United States. And out of that 4.5 million, you'd think that's all grade school and high school, but unfortunately it's not. That's really a small piece of the pie. The vast majority of the little kids that play football are in Pop Warner and other leagues that aren't really supervised in any way. In 2007, 920,000 athletes under the age of 18 were treated in emergency room and physicians' offices with football-related injuries. 47% had had at least one concussion, and 35% had had more than one in a particular year. And one Canadian hockey study revealed in hockey that there were 21.5 concussions for every 1,000 exposures. And an exposure is just bumping into the wall or to one player to another player. Then the thing that really woke everybody up about young kids and concussion was the football player you all may remember, 18 years old, who hung himself and was found at autopsy to have changes compatible with chronic traumatic encephalopathy, which we're going to talk about. Neurodegenerative mortality rate in professional football players is 3 times that of the general population. And the incidence of Alzheimer's disease and Lou Gehrig's disease is 4 times that of the general population. I couldn't resist putting that up here. How many of you have seen the movie Concussion? You'll probably understand this slide a little better if you've seen the movie, but it's a clinical dilemma, concussion, because it's a growing health problem in all contact sports. Concussion is increasing in spite of all the developments in helmets and all of the protective equipment and so on, the incidence of concussion is increasing. It may be because we're recognizing concussion more, but most of us think that there actually is an increased incidence, and you'll get a hint of that as I go on. There's no proven acute treatment. You can treat symptoms, but there's no way to directly treat the concussion. The injury has to run its course. And so the severity of a concussion is not really known until it has evolved, and that can actually take years. And so it's a very weird disease, to be honest. And uncertainty remains about when it is safe to go back into competition. So the days of having a driver who feels fine the day after having a little dizziness or a little headache because of a crash, and he feels okay, and some doctor friend says he's okay, and then letting him run the race on Sunday, those days are gone or should be gone. There are multiple criteria, guidelines that have been published through the years, but unfortunately they were based on just supposition and not really fact, and so they do not correlate at all with outcome. The old definition of concussion was reversible injury to the brain due to traumatic forces resulting in amnesia or loss of consciousness. That's way gone, and this wasn't that far ago that this was a definition. The new definition is this was in 2013, this established the clinical syndrome of biomechanically induced alterations of brain function, typically affecting memory and disorientation, which may involve loss of consciousness. And to really expand that and make it a little more clear, and this is an important thing to realize, you don't need to have been unconscious to have a concussion. You don't need to have directly hit your head, and we'll explain that in a little bit. You don't need to have been amnesic. You must have some concussion-related symptoms. By far and away, the most common, of course, is headache. They have a normal routine CT scan or an MRI. If you just use normal scans, those are normal. So you can't really detect it by X-ray, CT, or MRI. They may or may not have post-concussion symptoms. We'll talk about that in a little bit. And it's important to realize that repeated subclinical concussion, and what this is like in scrimmages and players like in the NFL, I'm not really picking on them, but football's so easy to use to explain this. You have linemen bumping their heads in practice almost on a daily basis, and then a lot of it in the game. These are not causing recognizable concussion, but we now know that this repeated over year after year after year, thousands of times, damages the brain. Talk about CTE now. You've all read about in the newspapers, and this is what's plaguing the NFL. It's not a new disease. It's dementia pugilistica, which was a punch-drunk boxer, and it's been known since 1928. And back then, it was mostly boxers, and everybody thought that only boxers got this. It's now a growing issue in contact sports, and it's also been not uncommon in Afghanistan and Iraq because of explosions of the IEDs and the number of concussions of our military and others, and regular citizens who develop significant concussion. And if they've been over there too long and had too many, they're now in trouble, and they're going to be a big burden on the budget for the American government because of disability. So it's a major health problem. It's a legal problem. Is there legal issues? The players' union, as you know, sued the NFL and had a settlement of now it's been raised to well over $1 billion. So it's a financial issue, and it's an ethical issue. Is it ethical, knowing what we know now, to allow a 6 or 7-year-old to go play football in one of these unorganized situations, knowing that they have a 20 to 25% of ending up in a nursing home with dementia in their 40s and 50s? It currently can only be diagnosed by autopsy, and the majority of us feel that if you recognize a concussion early and you treat it the way it's supposed to be treated, you won't develop chronic traumatic encephalopathy. There are no big studies about it for a while, and the NFL tried to say that it didn't really exist and wasn't related to football. There were many neurologists and neurosurgeons said that it didn't make sense. It must be some other reason for it, and so on. And that's because, as I said before, we used to think concussion was pretty innocuous. Now there's many studies in progress, and in 2010 there were 118 references on CTE, and that's multiplied considerably. So to define it, it's a degenerative brain disease associated with repeated brain trauma, both clinical and subclinical in nature, and beginning in early childhood. It's not something that's going to happen if you start in your late 20s or 30s, because you won't be able to do it enough. But it's when the brain is developing, and it's when kids are starting in early ages. So it's something to seriously consider in go-kart racing and so forth. There's a stepwise deterioration in memory, insight, judgment, and you get development of movement disorders, and finally full-blown dementia, which is clinically, you can't detect it from Alzheimer's, but it's a totally different disease. There's an abnormal protein called tau in Alzheimer's. There's an abnormal protein called amyloid. They get deposited in different areas. These are just slides that you can see. The one on the left is normal. The one in the middle is a boxer with CTE, and I'm sorry, the one on the right is a boxer. The one in the middle is a middle-aged NFL player. But the dark substance is this tau protein, which basically destroys your brain over time. Boston, there's CTE Institute now, or Brain Institute at Boston University, and the first paper that they did showed 68 cases, and they were ages 17 to 98, so you can have it as young as 17, just like the football player that killed himself at age 18. He was demented already. He probably started playing football when he was in 5 or 6 years old. 50 were football players, 33 from the NFL, 9 from college, and 6 from high school. 4 from the National Hockey League. There were 8 boxers and 6 veterans of Iraq and Afghanistan. Now, these were all people who donated their brain for scientific research after they died. Well, they didn't do it after they died. They did it before they died. The association found with Alzheimer's and Lou Gehrig's disease was 4 times that of the general population. Now, there's 165 people that have had autopsies, and 135 of them have been positive for CTE. There's 4 stages, and if you have anyone in your family or you know anyone with this, you can actually detect it early and help the patient a little bit, but there's no real treatment for it. You can only treat symptoms, very similar to Alzheimer's. Stage 1 are persistent headaches and the inability to concentrate. Stage 2 is depression, periods of explosive behavior, and impairment of short-term memory. Stage 3, executive function. They're not able to use a cell phone, use a computer, make any kind of important decisions. Multitasking's out of the question. Errors of judgment, worsening cognitive issues, and then stage 4 is full-blown dementia, and they require being in an extended care facility or nursing home. So concussion is not just a bump on the head. There's altered brain chemistry. It's not like a bruise. It actually alters the chemistry of the brain. There's an energy crisis, and it's because the blood vessels constrict, decrease the flow of blood into the brain. You can't get enough glucose or sugar to carry on the metabolism of the brain. And so a whole lot of things happen, and I won't go into those. They're all medical and so forth. But it's just, it's a major chemical mess that occurs in the area. And the only difference between a concussion is it's a small area, and a big head injury, and maybe some of you have heard of diffuse axonal injury, is this chemical alterations are in the entire brain rather than just a defined area. Excessive activation of the affected area. In other words, if you allow a person with concussion to be up and around and doing things, the concussion actually gets worse. But if you keep them from doing anything, it also gets worse, and you have to time that. And then the developing brain is uniquely vulnerable to trauma, and it's different in kids. Kids are more susceptible to concussion, and they have more risk having a concussion, and repeated concussion in children is really bad. This is just a quick slide. This was a study on rats. They put them in body casts after inflicting a concussion, and the concussion actually got worse, so it didn't help them. In this one, they did a minor head injury on one side, so you had an infected limb that didn't work very well. So they casted the good limb and made them work the affected limb, and the lesion got bigger. So it's a therapeutic dilemma. You have to know how long to rest somebody and when you can gradually let them increase their activity. So what actually causes a concussion? It's acceleration of the head, which makes the brain that's sitting inside your head. It's connected to the spinal cord, but it's in the cerebral spinal fluid inside the skull, and the brain is free to move. It can twist, it can go forward, it can go sideways, it can go backwards. So there's three types of acceleration involved. The first one is translational or linear. That would be like walking straight into a flagpole. If you did it exactly straight on, you would not have a concussion. You might have a skull fracture or a contusion of the brain, but you would not have a concussion. Pure rotation is rare. That would be, I'll give you a quick example. We had a car at a test one time that did a quick snap spin on the backstretch. It just went around real fast and front to front. And the driver was slumped over in the car. I thought the driver had a heart attack. We got there, he was waking up and seemed to be fine. And what had happened is that was a rotation in one axis. He'd had a concussion. Nothing had hit his head. But now I know, I didn't know it then because this was many years ago, now I know that he had a concussion. But the most common thing is angular acceleration, and that's where that's a combination of linear and rotational acceleration. There's two types of application of the force. There's impulsive loading, now called non-contact, and that'd be like whiplash or shaking baby syndrome. And then there's impact loading, and that's where you actually, the head gets hit, but it's not where it's hit that causes a problem. It's the motion of the head after the head's been hit. So significant brain injury can result in either one. So it is not the direct blow that causes a concussion, it's the angular acceleration. This is a video of a rear test to really look at back injury and what happens in a rear impact. But when you see the car goes back into the wall, it's a 70G rear impact. And if you look at the head when that happens, the head actually almost comes up out of the cockpit and is thrown back rapidly. This would cause a very significant concussion, even though the head was never actually hit. And this is just a CT scan of shaken baby syndrome, and you can, it's the same thing. The head is not hit. One of the parents is shaking the baby, and the brain's going back and forth, and they end up with a severely damaged brain. This can actually be fatal. So can a good helmet prevent concussion? And this is a concept that I want to really get across. The helmet shell protects the wearer from external impacts and penetration. So you have to have a helmet. So I'm not knocking helmets at all. The helmets are fabulous. The development is tremendous, but it doesn't really keep you from having a concussion. The helmet liner absorbs some of an internal impact where the brain impacts the inside of the skull. Some areas of the inside of the skull are not very friendly to the brain and can cause a lot of damage, and the brain moving inside the skull, however, is what causes a concussion. It's because of shearing and strain injuries to the nerve fibers. I'm being facetious here, but it's quieter with a helmet on, and the helmet it keeps your head warmer. But it's important that a helmet itself can cause injury. There was a girl who was a downhill, going to be one of our good downhill skiers in the Olympics, who went in doing moguls and went into a snowbank and fell and hit her head, and they got to her, and she had a very bad head injury. And it was really not that hard of snow that she fell into. She died within 2 hours of what's called a subdural hematoma. And what had happened is the helmet liner was too stiff for her age group, and it actually caused the skull to be affected and tear the bridging veins. And she had bleeding between the bony part of the skull and the surface of the brain. And by the time they got her to the hospital, it was too late and she died. The current tests of helmets are only somewhat refined from this early test method. And this is really true. Angular accelerations have not been tested. Now, they have been in some research studies just recently, and we're planning to put them into the NOCSE standard for athletic equipment, and but otherwise, there's not been any really good angular testing for standards. And so therefore, concussion is not really part of what helmets are made for, and they're not going to do much good anyway for that. Football helmets today are based on tests designed in the mid-1960s. They must protect from a force that would cause a linear skull fracture and a cadaver head. That's where this came from. And the linear fracture of the skull has nothing to do with a concussion whatsoever. But it was thought at the time that the force it required to break the skull was what caused the concussion. We now know that that's not true. As I said, angular acceleration is not really considered in the tests. They've had minimal refinement since the 70s. The helmet companies, one of them said they had a concussion-proof helmet at one point about 3 years ago. They're better, they're more comfortable, there's some improvements in the design, but not really to prevent concussion. And as I said, concussion is actually increasing in spite of the latest and greatest football helmet. Weight in football helmets is given very little consideration, and they're not custom fitted. I was shocked by this because I did a study with the University of Miami football players, and they just have small, medium, and large helmets. So the players just pick a helmet. They don't even have the same helmet every day. They just put a helmet on that is comfortable and then go out and do a scrimmage or play the game. This is a typical football helmet. This is one of the college players. It weighed 5.5 pounds. If you put the face guard on, it was 6.5 pounds. Costs about $450. You can see the inner liner isn't much. It's mostly a comfort padding with some protection, but it's not real great. The motorsports helmet today, either FI8, 8860, or now, starting this year, Snell 2015, is quite a bit different. The weight is given great consideration. There are multiple layers of special weaves that Yves can tell you a whole lot more about than I can. And it gives greater impact protection and from intrusion, something going into the helmet and then into the driver's head. And starting this year, the visor has been made out of a material similar to a fighter jet window, so that penetration of the visor is a lot more difficult to have. And they're custom fitted to the individual driver. So this was about a 2-year-old helmet. It only weighs 2.2 pounds compared to 6.5 pounds for a football helmet. When angular acceleration, the greater the mass, the more the thing weighs, the angular acceleration is going to get more. So if that's what causes a concussion, the easiest way to improve risk of concussion is to decrease the weight of the helmet, but you still have to have the impact protection, but this has a whole lot of impact protection. And I've heard you can actually park a vehicle on the helmet and not crush the helmet. So at least 30 to 40% of concussions do not involve head impact at all, and in racing it's near 50%. Angular acceleration increases as the weight of the helmet increases. The football helmet has to tolerate many hits. All day long they're banging heads together. Racing helmets designed to withstand the big one. Maybe somewhat, we're working on getting it to also maybe tolerate another significant impact. The liners, therefore, have different requirements. The brain does impact the inside of the skull, as I said, and with angular acceleration, what does the concussion or shearing and strain forces in the brain. And this is just a graph that shows the heavier the helmet, the greater the rotational accelerations. Neuropsychiatric testing, it's important now to do this to diagnose the concussion. This wasn't done until about 2001, 2002. The first, or the gold standard, is IMPACT, which is immediate post-concussion assessment and cognitive testing. It's used in all of those organizations now. It's primarily you have a baseline to go by, so if the baseline's altered subsequently, the patient is probably, or the driver has probably had a concussion. It's also important to normalize it before you go back into competition. And it's really the best thing we have now to do that. It's available worldwide in 17 different languages. It all goes to the University of Pittsburgh. They read the test and answer it within usually 35 to 40 minutes. You have to be trained to give the test. There are a number of people all over the place that can do that. Another test that is fast becoming popular in a lot of areas of contact sports is the King-Devick test. And this is just a simple task of reading numbers in sequence. And they're printed on 3 levels of cards, and you don't have to be trained. Anybody can administer this test, and it tells you how to grade it. And it's a quick, kind of a quick and dirty assessment. It only takes 2 to 3 minutes. It's less than 2 minutes. Impact's 25 to 35 minutes. King-Devick, if you keep doing it over and over again, you get better at it. Impact, you can do it again and again and again, and you won't get any better. You won't get a better score. Neither one of them studies balance or vestibular function, and that's important for return to competition and also for diagnosis. Then there are tests called SCAT-2 and SCAT-3. This is Sport Concussion Assessment Tool, and they've been around a long time. SCAT-2 the longest, SCAT-3 is a little newer. They look at symptoms, dizziness, nausea, headache, and so on. They have and they also look at your mechanical ability, your balance, and cognitive. They look at cognitive things. It doesn't take too long to administer, but as many of you probably read about, we had an issue with that 3 weeks ago with one of the IndyCar drivers who, after a really minor crash, had symptoms that triggered the SCAT test as positive. And the question came up, did he have a concussion in this relatively minor crash? It turned out that we examined him at the University of Miami with a lot of extensive testing, and what he had was an inner ear infection and cervical neck muscle spasm, which triggered the symptom thing on the test, but he did not have a concussion at all. It was this subsequent illness that he had over the weekend when he was trying to drive the race. There is still no agreement on the role of these tests, but there's nothing any better. There is a new thing coming down the road, which was developed in the military, which is a visual test of rapid eye motion. And your eyes are asked to follow certain dots and things. And it's pretty complex, and it takes about 3 hours to administer, but they have a form of it coming out that'll be 7 to 8 minutes. And my guess is that this will become the gold standard, and probably within a year and a half. And we're one of many at the University of Miami that are studying this, and it looks really good. The physical signs of concussion: any loss of consciousness, but remember, you don't have to be unconscious. Any amnesia, but you don't have to have amnesia. A seizure at the time of impact. These are usually with impact, and it's so-called impact seizure. It's a seizure that lasts less than a minute. These are not uncommon and look really bad, but if it lasts less than a minute, it's a concussion. The subtle ones are kind of a vacant stare, inability to focus, easily distracted, slurred speech, slow to answer questions, disoriented, unsteady gait, a sudden personality change. I tell the story of I think it was the Pittsburgh Steelers, Mean Joe Green, used to play with him, came off the field after a pretty big hit one time and was sitting on the bench, but he walked and he talked okay and all that. And the guy that invented impact testing was their observer at the game, and he saw that he was crying. And no one had ever seen Mean Joe Green cry. And this was totally, different. They did impact test, and he was more than 2 standard deviations off of his normal, so they kept him out of the rest of the game, and he'd had a significant concussion. They can have emotional instability, inappropriate behavior, and delayed responses to commands. Symptoms are headache. It's almost always present. Dizziness, vertigo, lack of awareness, nausea, vomiting, loss of balance, feeling dazed or dingy, ringing in the ears, which is called tinnitus, blurred or double vision. And they also get photophobia, which is can't stand bright lights, and an entity called hyperacusis, where they can't stand loud noises, or they want everything to be quieter, and that's a real clue that there's been a concussion. And then just not feeling right. We had a driver one time who looked fine after a crash, and about 15 minutes later, he came into our medical unit and he said, I don't feel good. And there was nothing specific. So why don't you feel good? Well, I don't know, I just don't feel right. And we tested him with impact, and he was markedly positive, and he ended up having post-concussion symptoms for 3 weeks and was missed a subsequent race because of it. So the bottom line is the person examining anyone for a concussion must have a high index of suspicion, and you base it not only on the patient, but damage to the helmet, if any, damage to the surrounding area. In other words, how bad a crash was it? We've learned with Indy cars, because it's such a standard vehicle, that you can almost look at the car and the area of the crash and the video and know whether a driver's probably had a concussion or not, or at least a concussion or not. Athletes themselves are notoriously at underreporting symptoms. They don't want to be taken out of the game, and they'll actually lie. You say, do you have a headache? No, I'm fine. Any trouble with your vision? No, it's great. And even though they really aren't, and those are the ones you really have to catch and not allow to go back into competition. So we need to train the chief mechanics, crew members, team managers, families, other drivers to recognize when somebody isn't acting right and has some of these symptoms, so that they can be tested and not allowed to go back into competition, because that's where you get in trouble. Any symptoms or signs, no return to any sports activity. The little saying is, when in doubt, sit them out. The athlete should be medically evaluated every 5 minutes for either the symptoms and signs going away, or if they're getting worse. It should be watched for at least an hour at the event. And these places where you drive in, race your car, go home, this doesn't happen. And this is where the CTE can become an issue in motorsports, is in club racing, in some of the series, for example, in stock car racing, where they just blow in for the weekend, race a car. They don't really have an adequate medical person there to evaluate it. And the driver says they feel fine, they're allowed to go home as if everything's okay. When do you need a CAT scan or an MRI? If there's a symptom of a structural lesion, and we call these in neurology a focal lesion, which is something to indicate a defined area of the brain that makes something malfunction. If you have one eye, you can't open your eyes, or you can't move one arm, just symptoms like that, you obviously have to have a CAT scan. Seizure activity of more than a minute, prolonged disturbance of consciousness and getting worsening level of consciousness. Under observation, you need at least a CAT scan. And then persistent or cognitive symptoms that don't gradually go away over 2 to 3 weeks, then you need to have an MRI. As far as return to competition, it has to be graduated. Remember the experimental slides I showed about too much activity. In the very beginning, you'd want absolute rest, and this means no video games, no television, nothing. It's just eat, sleep, and sit, and until your symptoms are gone, the acute symptom. Once the symptoms are gone, then you can start with light aerobic exercise, such as walking or stationary bicycling with a helmet on if you're on a stationary bicycle, so you don't happen to fall off and get another injury. Level 3 is sports-specific training in skating and hockey, running and soccer, simulator in the race teams, race shops, go-kart in a safe area, or a family car in a big parking lot someplace, and see how that goes. If no symptoms return, then you go to level 4, which would be return to the sport with supervised private practice, with attention to consistent competitive times. The biggest thing in motorsports, if you've recovered from your concussion, you go back and your times aren't all over the place like this. they're consistent and gradually improve back to pre-injury levels. And that's very important. If they're bouncing all over the place, they got to go back and to a lower level. So what have we learned about concussion? Mild TBI, which is concussion, can have long-term catastrophic effects, and it truly is catastrophic. Nick Bonacani told me about a month ago that he visits regularly. There's 4 Miami Dolphin players who are in their mid-50s who are in nursing homes in Miami, hopelessly demented from the older days of playing for the Dolphins. Most, but not all athletes recover quickly. Age may be important. Old people do worse with concussions than younger. Neuropsych testing is useful and actually necessary for getting people out of a game and when to go back. And management there's multiple components, the levels that I talked about. What we still don't know is how many mild brain injuries are too many, how close together is too close, when is the brain really back to normal, and is there any effective pharmacological therapy? There's some things coming down the road, anti-inflammatories, they're different than like Motrin or Advil or whatever, they're for the brain. Exact role of age and development. Kids and women are more vulnerable to concussion. Nobody knows why that is. Role of genetics. Concussions seem to run in families. And if people with migraine, ADD, or the gene for Alzheimer's, all those things are risk factors. Prevention is stay inside and don't do anything, which nobody wants to do that. Otherwise, wear an appropriate fitted helmet in contact sports, head and neck restraint system in 4-wheel vehicles. And I use the word system because it has to work with the seat and the head surround and all of that. Newer devices are now available for motorcyclists. Recognize concussion and get out of the event, and no return to activity until the symptoms are gone and the neuropsych test is back to normal. And there probably is going to be rule changes in both football and hockey, or there won't be football anymore for sure. Thank you very much.
First of all, it's great to see the work being done in this, and we know about work in football and all the attention that's gotten, but to see it happening in racing and to see sanctioning bodies actually looking at how they might test those drivers, and you've seen cases where they've kept them out of races, and that's a good thing.
You're out for the weekend, and Sunday afternoon you do a head walk off your motorcycle at 150, and you seem to be okay, and you pick yourself up and you get home, and Monday morning you feel like shit. Okay. How do you go to your doctor and tell them this?
You should see your primary doctor first, and they should be, by now, with all that's going on with concussion, they should be tuned in with the fact that that's what happened, and send you to a neurologist or a concussion clinic, and they're rising all over. There's a word of warning, though. There's people calling themselves a concussion clinic who really aren't. There's money in it, and they're really not the right people to go to. So you need to go to a recognized concussion clinic, a neurologist, board certified, that works with concussion, and let them manage the recovery and when you can go back to riding your motorcycle again and doing things. It's really important, because to not do it, you can really get in trouble if you have another concussion too early and you endanger other people. It's in football, only the player is at risk. In motorsports, if you have somebody that's had a concussion, say on one weekend, and they race the next weekend, they still have the effects, they can endanger somebody in the pits, they can have a crash and kill spectators, they can cause any kinds of havoc. So it's extremely important in motorsport.